The most effective way to keep your eyes healthy is to know the facts. We're talking all about eye health with Dr. Khan and Dr. Anderson from the shops of Angus Glen Optometry today on In the Know. From a young child to a senior, taking care of your eyes is very important. Here to talk to us about eye health are Dr. Khan and Dr. Anderson from the shops of Angus Glen Optometry in Markham. Welcome to In the Know.
Thank you for having us.
And I have to tell you, in over 10 years of working here at Rogers TV and broadcasting, this is the first time I have ever worn my glasses on TV.
Wow.
Congratulations.
So thank you for that. I don't know if I look like a different person at home, but...
They look fabulous.
So eye health is very important. Before we get to that, tell me about Angus Glen. You are the shops of Angus Glen Optometry. You are a husband and wife optometry team.
That's correct.
Yes. Yes, we actually just opened up our practice about 6 months ago, very close to where we live. So it's been great getting to know our neighbors and promoting the fact of how important it is to get out there and get your eyes checked. We live in an area with lots of schools and Montessori schools, and a lot of parents need to just kind of know when to start bringing in their children. It's a very common question.
And you're still smiling, husband and wife working together.
Smiling.
We don't work on this.
Because we tag team.
Oh, okay. Tag team. I got it.
Because you still have to balance the family time and the office time as well.
Absolutely. Okay, so speaking of families and kids, kids need to start checking their eyes, or parents need to take their kids to check their eyes from an early age.
Absolutely, yes. It's a very common question that we have in our practice is when to start bringing in the children. College guidelines are usually starting at least at 6 to 9 months of age, actually in infancy, yes. And then we continue to get them seen between the ages of 2 to 5, at least once, and then from school age every year. And OHIP actually covers an eye exam once a year for children. So it's very important because, you know, children won't know when their vision is blurry. They don't have a reference of anything but a blurry world if that's the case.
Right.
And, you know, adults come in every 2 years and they ask us, you know, when do we start? So 1 in 4 kids is actually diagnosed with having a vision problem. And a lot of times these kids can be labeled as having attention deficit or learning disabilities when really they just can't see the board at school.
Because their world is foggy.
That's it, exactly. So, you know, we've been going out to a lot of local schools just to promote it to even the teachers to say, listen, look for certain signs with the fact if they're squinting, if they're rubbing their eyes, or they're just not feeling challenged to really read or letter recognition. These are all very common signs. A lot of parents might come in saying, you know, my child's always rubbing their eyes, or you know, they sit really close to the TV. These are all common things.
Now, sitting close to the TV, I've already asked my eye doctor this, does that cause bad vision, sitting close to the TV?
Normally, it's a sign that something has already happened. It's a sign that a child cannot see the television, so they're going to move closer. So oftentimes, the old wives' tale is, oh, sitting too close to the TV will wreck your eyes. Chances are they're having a hard time seeing it anyway, so that's sort of a signal, hey, mom or dad, time to have the eyes checked.
It's not a causal, it's an effect already. It's already happened.
Exactly.
Okay.
And 80% of learning for children is visual. So if they can't see what's on the board, and if they're having trouble reading, learning to read, that's also an early sign. I mean, we've seen great differences in academics for a lot of kids who've actually needed to wear glasses and see better. So. And
there's a lot of kids we've seen who aren't showing these signs, but it's still, you know, you may have one eye that's seeing very well, but the other's not functioning properly. Okay. So it doesn't necessarily mean if you don't have a complaint or signs or symptoms, that doesn't mean everything's working well. So it really emphasizes the importance of coming in and getting a thorough check on both of the eyes, making sure they're working together.
So walk us through what a typical eye test would be for a 3-year-old. I know there's probably people at home saying, I don't want my child to get drops in their eyes, or, you know, things like that. It's not that scary.
No, it's not that scary. And, you know, we like to keep it friendly the first couple of visits just so that they're comfortable. Kids do not need to know their letters. We have many different ways, especially for infancy. We have very subjective ways of performing an exam. But, you know, we always want to check the vision, visual acuity, which is how well they're actually seeing. We check for depth perception. You know, for us, we may relate to that as 3D vision in a way. Color vision, for instance. We do binocular vision, and then we look at the overall health of the back of the eye as well. Are both eyes moving together? Are they having a focusing issue? So there's different tests that we can perform in office to do that.
And very easy, very non-invasive. We kind of like to make it like a game, you know, fun lights, fun little, because kids they like interacting and seeing things new. So a lot of them are little pictures and things like that. We don't necessarily have to touch the eye, you know, because they have to know that it's easy. It's fun, you know, but healthy at the same time.
Right, and it's an experience, right?
That
When we
is.
took my daughter's will be 4 in February, and the eye doctor, you know, covered her eye with a little black thing.
Yep,
You know what it is,
spoon.
and it's a little black spoon. And she said, pretend you're a pirate, and you know, it's very, you know, show and tell and playing.
Absolutely. And the nice thing is I'm actually a part of the Ontario Association for Optometrists, and we have this wonderful program called I See, I Learn. And what it actually does is it allows, we work with the government in providing a child who is in junior kindergarten who may actually need a pair of glasses. So the government funds a free pair of OGI eyewear glasses with Nikon lenses. So this is great. They get their free pair of glasses, so it's no cost to the parents. And it's a great program because it's allowing us to really get kids started early.
Wow, and who's eligible for that program?
Anyone in junior kindergarten. So right now it's for any children born in 2011. So, and then next year it'll be for kids who are 2012.
That's excellent. That would be my daughter, yeah.
Exactly.
That's
So
fantastic.
it's a very good time to get them started in.
Okay, so how much of eyesight, and we can talk about this more when we're talking about seniors, Dr. Anderson, is genetic?
Good question.
Where's the genetic disposition there?
It depends who you ask. It depends on the studies. A lot of patients that we have, especially kids coming in, mom and dad don't wear glasses, but yet we find that they need a prescription. On the opposite, mom and dad have very high prescription, you know, poor eyes as they would consider, and the kids are just fine. So the main thing is it's not as genetic as we were once thinking. That does play a role, but a lot of it is sort of the nature versus nurture question. How much are they spending on iPads? How much are you letting your eyes rest? Are you overstraining the eyes? There are many, many factors that go into it.
Okay, and then another good news piece is wearing glasses is trendy now for
That it is.
whatever reason. Wasn't trendy when I was 10 years old, but lots of great frames, funky frames.
Absolutely.
Kids aren't embarrassed anymore.
That's the thing, because there was almost one style, like, and no one wanted to really see, you know, wear glasses. But now it's become colorful, and they're actually very similar to what mom and dad might be wearing. So kids want to grab that red pair of glasses and the purples and the greens, and they look really nice to, you know, be as an accessory in your face as well.
They show off a little bit of their personality for sure.
Yes,
Exactly. I think kids like showcasing the personality just as much as their parents do.
Okay. All right.
And Ray-Ban's actually quite a popular brand as well for kids. They're very durable as well.
Okay, well, when we come back, we're going to talk a little bit about seniors' health. Prep us on that, Dr. Anderson. Seniors' health and seniors' eye health, rather.
Well, just in general, it's, you know, as we get a little bit older, sometimes things don't work quite as well as they used to. And the important thing is not to chalk it up to just, oh, I'm getting old, something's going on and to be expected. But also, a lot of people don't know what's common as you age, and then they don't know what to, you know, how to take early steps in preventing, you know, bad things from happening sooner than they should.
So we're going to talk about that when we come back. More in the know after the break. Welcome back to In the Know. We are talking all about eye health today with Dr. Khan and Dr. Anderson from the shops at Angus Glen Optometry. So we're going to move into getting a little bit older. And everyone kind of knows or suspects that when you get older, you're going to need glasses, but other things are going to happen to your vision. And what happens when you get older, Dr. Anderson?
One of the most common things is the beginning of a cataract. And there's this stigma surrounded by cataracts. When patients come in, if we're informing them there's a minor cataract starting, they think, oh God, this is the end of the road.
I'm 80.
What's going to happen? This is a
my
disease. And the main thing is it's normal. You know, it's a natural clouding of the lens inside the eye. So as light rays are coming in, instead of focusing at a nice sharp point on the back of the eye, they're getting scattered. So people
I
may
think we've got an image of a cataract, right?
Yeah, we do. We've got sort of a simulation of, you know, it's similar when the windshield's dirty on your car, you know, the light rays coming in, so they're getting
You're
scattered.
just looking through a dirty lens, basically.
Okay.
So,
dirty
and
lens.
it's a natural aging process, just like our skin can get sunspots. You know, it's natural sun damage, yellowing of that lens. So you're looking through a cloudy window.
So from the person's perspective, it looks cloudy.
Exactly.
And it's going to be a very gradual process.
Okay.
And a lot of similar, symptoms that are common that you may experience is, oh, nighttime driving is difficult because I see a lot of halos or starburst effects around lights.
Right.
Things are unfocused. Those are all very common symptoms that you may feel when you're getting a cataract. And oftentimes, a lot of patients who are on medications, they can get the development of cataracts a little bit earlier on as well.
Right.
So through the illustration there, you can see how light is coming into the front of the eye, and when it's going through the lens, the natural human lens that's right behind the colored part of our eye, all those little light rays are scattering. So imagine if you haven't cleaned your windshield in a few days and you're driving at night. When those car headlights are coming in or street lights, they're just glaring out. They're really feel like your vision's foggy.
Right.
A lot of people say they feel like they need to take their glasses off constantly and clean them, but the problem is actually inside the eye.
Inside the eye.
And this process begins from day one, as soon as you're born, because the lens inside of our eye is very similar in composition to the clear part of an egg. So you can imagine when you take an egg, put it on the frying pan, it goes opaque. So the same process is happening in our eye gradually over 60, 70, 80 years. So for number one, people always say, well, how can I prevent them? You can't prevent them. It's going to happen to essentially everyone. But there are certain steps you can take. Anything that's healthy for the body is healthy for the eyes. UV protection is number one. Sunglasses, avoiding of the sun. Things like that. Also, you know, the green leafy vegetables, anything that you think is good for the body is also going to help with the eyes as well.
Here's a funny question. Are carrots actually good for your eyes?
They are. There's actually certain vitamins. No, good question, because there's actually certain vitamins in certain foods that are actually very beneficial for the eyes, more so than others. Vitamin A, vitamin C, lutein, zinc, green leafy vegetables for sure, as Kevin mentioned. Sorry, I'm like, that's my husband. So very important. But sun protection, 100%. A lot of patients say, you know, I don't have a problem. I don't wear glasses, but anything, you know, hitting the eye, you should always, sun's not the way it used to be. Put it that way.
To expand on the carrot, that's actually a bit of an old wives' tale. That was sort of a media frenzy back of World War II. So parents are always thinking, oh, my kid, he doesn't need glasses, I'll just feed him a bunch of carrots. Well, that has the beta carotene, but there are also a lot of different carotenoids in everything. Like I say, eat a rainbow, the green leafies, everything that has pigment, you need that.
Okay, so for the cataracts, at what age generally? It's going to happen eventually, like you said.
It's going to happen eventually.
Is it like a 60-plus thing? Is it like an 80 thing?
On the average, we start to see early symptoms. You know, we can see it in the exam around late 50s, early 60s.
More common after 50, but there's certain medical conditions, like if you're diabetic, for instance, that can also accelerate the maturation of these cataracts at an earlier age. And then there's some people who are well into their 80s and 90s who they're actually not ready for that cataract surgery yet, because it hasn't reached that point yet.
Okay, so is that the way you fix it with surgery?
It is. It is. It's a very quick, easy procedure. Now, that's why we are always promoting for eye examinations every year for seniors over 65, which is also covered by OHIP. Once a year, again, there's so many more changes happening in the back of the eye. It's not just about seeing 20/20 or I'm okay with my glasses. It's checking the ocular health as well.
Absolutely. Okay, so the other one that kind of freaks me out, macular degeneration.
Macular degeneration is a little more serious than the cataracts, because macular degeneration will not happen to everyone. Right now, it's currently affecting around 1.5 million Canadians, and it's getting a lot more press.
Very small percentage of the population.
Very small percentage of the population, but that number has increased by 30% over the last 10 years, and will continue to do so as Canadians start living longer. It's not all about being alive, it's about being live and healthy. So again, preventing those early aging changes in the back of the eye.
And what does it mean?
So macular degeneration, the full term is age-related macular degeneration, because oftentimes it is related to aging, usually late 60s, early 70s. There is a genetic component to this, we know. So I believe we have an illustration. So the macula is a central part in the back of the eye, and if something happens to that, our vision is most certainly going to be affected. The reason that macular degeneration is so scary is, there you go, in the illustration, as light is coming into the eye, it hits the sharpest point right at that center part, and that's our sharp vision center. So what happens is people that have early to moderate macular degeneration, their central view is going to start to get blurred, distorted.
Their central vision is what usually goes first, and that is obviously very difficult for people to function. I mean, I wish we had those glasses to illustrate, but your central vision, so everything you look at almost has a...
So kind of that, like a blurry right in the middle.
Exactly.
So the view on the left is normally what you would see when driving a car, and someone on the right view would be someone more in the moderate stages of macular degeneration. And imagine how difficult it would be to function if there's a permanent blur in the central part. Everywhere you look, you can't recognize faces or see things like that. And so as we're living longer, it's getting more important. For one, like Dr. Khan was saying, every year have eye exams, because we can see this change way before it affects vision. There are certain tests that we can do, and if caught at a very early stage, it's much easier to sort of do preemptive care, to have them referred to an ophthalmologist as well. We co-manage a lot of patients. Again, emphasizing nutrition, so the diet has a lot to do with very specific high-dose multivitamins that it's not for everyone. So that's why we say it's really important to work with your eye care professional.
And just to add a side note on that is like the main risk factors are people with light eyes, actually. People who
Like
have
colored eyes?
colored eyes, yes. Like I have a little bit more pigment to support, to protect from the sun. So people with very light eyes are at higher risk. It does tend to be a little bit more common in women, and smoking is probably the #1 risk factor. Okay, so smoking or even a long-term history of previous smoking, and
Caucasians more so
yes.
because we have the more fair skin, and someone in the family, a first-degree relative that has that, it's big. So any more than one of those factors is actually extremely important to come in.
Okay.
And we've seen it start as early as in the late 40s.
Wow. Okay. And so the key for all of these, we didn't even really talk about glaucoma, but we can touch upon it in the next segment, is to be aware, go to the eye doctor every single year from age 60 even up.
We used to say every 2 years for healthy adults, minimum every year, over 65 or older, and for diabetics as well.
Okay.
So at least after 19, 20 to 64, every 2 years.
Okay. We have to take a short break. When we come back, we are talking about frames and how much fun we can have if you have a vision issue and you need to wear glasses. More coming up. Welcome back to In the Know. We are talking all about eye health today with the shops at Angus Glen Optometry. Dr. Khan and Dr. Anderson are here. So if you are blessed with poor vision, such as myself, I've been wearing glasses since I was 10 years old.
Okay.
Less so after I became a teenager because at the time, glasses were not cool. You didn't want to wear glasses.
Yes, and we still hear that sometimes.
Yes, but at times they are changing.
But I'm wearing my glasses today. I do wear them. I try and take out my contacts as soon as I get home, just to give my eyes a break.
Absolutely.
And when I'm at home, I try and wear my glasses. But I think they look okay.
They look fantastic.
And there's so many different frames that you can choose from and really use your frames as an accessory.
Absolutely. I am a true believer that, glasses are just like any other accessory. You don't always have one pair of shoes, one belt, one necklace. It's on your face. It's a statement piece. It talks about your personality in a way. The options have just grown so much, so much color, so much texture, and it really has become such a fashion item. So most people do come in with getting at least 1 to 2 pairs to have a different look.
Absolutely.
Right?
And you might want something a little bit more bold, something a little bit more sleek.
Exactly.
What we're finding is people are used to the streamlined, I just have to have these on. I'm dealing with them. Now people are coming in, they want to go bold, they want to make a statement, they want to actually be noticed in the glasses.
Yeah, a few years ago it was all those, frameless and invisible glasses.
Yes.
And now everyone wants to show them off. The bigger, the bolder.
Exactly.
And nerdy glasses. But now nerdy is cool.
It's cool. The hipster
I don't know what
right now.
happened, but
oversized and colorful, exactly. So, we still have that patient who comes in saying, I love my, rimless, flawless glasses here, and then I start easing them into something like a Lindbergh, per se. This is a titanium frame. There's no screws, and the beauty of it is they'll last you forever, and they're light as a feather. If you just sort of felt that.
Wow.
Right? So really nice, all different colored options. And these you can actually get engraved with your name in it.
Yes. Customizable.
Very customizable for you there.
Look at that.
But by the time we start introducing them, we get them wearing something more bold.
Yeah. So are all glasses made the same way?
Absolutely not. There are lots of different materials. There are some made in various countries. There are some that are literally made to fit you, like this brand that you're talking about here. This is where a client will come in and actually sit down, start showing different sizes, shapes, colors, and you can really sit down with a palette. It's like decorating, so you can change the material. This is where you really let your personality come through and make a statement. And
now, are these like an anti-shatter or something? Because they're so small that I feel like I would crush them.
Well, these are just demo lenses, so definitely.
And the frames are titanium there, but for the lenses as well. So it's all about the frame and the actual lens. The frame is where your personality comes out and the comfort, and then the lens is what really gets customized for you.
These are cool.
And this is actually a hand-painted frame. So you get one color inside, one on the outside, also titanium, light as a feather, but that's a handmade frame.
So this is just not rolling off in an assembly. This is someone sitting down and hand-painting each frame.
Wow, these look very European.
They're built to last. It's actually a Dutch company.
Oh, see, there you go. I'm going to try these out. Now, I can't see when I take these off, so...
We'll be your judge, not to worry.
No prompter or anything, but...
Yep. See a little
funky.
I think we've got something that's
I think we need to know when
a little more bling for Julia.
When you're buying glasses, your eyeball needs to be in the center of the lens, right?
Yes, there's many factors that we look for when we're actually fitting a client with a pair of glasses. For instance, when you put this one, we look for features such as, are your eyes well aligned in there? You know, is the frame too wide?
These ones feel good, actually.
Yes,
They
and they
look
look
stunning.
actually beautiful. And if you look at the side detail, I don't know which angle we have here, these are actually Swarovski crystals. So if you want to have a little bit of fun, especially for nighttime, just gives you a little pop of excitement there.
I'll trust you. I'll watch the show after the fact because I can't see anything. I'll tell you
No
that.
problem.
This is where kind of like, you know, you wouldn't go online and buy your shoes. You don't know how they're going to look on you, how they're going to fit.
It's
Same
true,
thing with
yeah.
glasses. It's really a sit-down, a personal fit
And it's
experience.
personal, yeah. It's
It
not like
is.
a hand-me-down experience. You
Exactly.
It takes time. It's an individual choice, for
This is
sure.
the first thing that someone's going to notice when they see you. It's not going to be the bag or the shoes. They're going to see your face. They're going to see the glasses.
Exactly. Now, what you can do if you've collected frames over the years, as I have,
Yes.
if your prescription has changed, you can still upgrade that prescription, that lens inside, if you like the
Absolutely.
frame.
It is doable, yep, to use as a backup. A lot of
Yes.
people would do that just to have something around in case, or they'll use that as their cottage glasses or their vacation
Yeah.
glasses.
Vacation
Just a backup
glasses,
pair,
Exactly.
yeah.
So it's
if
good to
you
have a
lose that.
backup.
And the nice thing is a lot of insurance companies now cover glasses every 2 years for most adults, and
Yes.
even for their eye exam fees. So it's nice to take advantage of that, because especially now with the holidays coming up, a lot of families are going away. So we're always encouraging, you know what, get your sunglasses, get your other pair of glasses. Even for kids, I mean, sun protection is so important for them. They're 3 times more susceptible to sun damage than we are. So we have these little mini mommy and daddy looking glasses,
adorable.
right? They're little tiny glasses. Little flash
Styles are
lenses, so
changing
they
a
can
little
just
bit.
look like mom and dad on the beach. And even for the winter season, we have skiing.
Adorable. Look at that.
That's gorgeous. So
Little
cute. My daughter wears that in the pink, actually. But even for skiing, you know, Oakley has great skiing goggles there.
And a lot of the goggles come with interchangeable lenses, so if it's a cloudy day or a sunny day, you can boom, change on the slopes. It's not slowing you down, and maximum protection for the eyes as well.
And as much as these are all obviously about fashion, they're also about function.
Absolutely.
Primarily function. They have to do their job, right?
That is very true.
Oakley's been around forever.
They've been around forever. What a lot of people don't realize is that Oakley has a very amazing women's line. So the bottom frame that you have there,
This pink
on
one
the
here.
stand
Sorry,
there.
here.
Oh, this
so
one here.
it's one of the
Pink one.
pinks and the roses, so then you're getting the good polarized, you know, lenses, extremely important for the eye health. But instead, women in particular aren't limited to only a couple pairs of glasses. Now they can get into, you know, it's a very athletic line.
Absolutely.
And then the top ones there are very good for road biking. That's actually the pair that I use as well. We do some cycling.
And then the ski goggles, which the Blue Jays kind of made famous just
They
a few
did.
months ago.
Absolutely.
Go.
This is in
yeah.
the famous locker room champagne parties right there.
That's
so
true.
Reason to celebrate
But
and
great
protect
for
your eyes at the
skiing
same
too.
time.
Yeah,
Absolutely.
Great for skiing and
It does
snowboarding too.
That's right.
Dual purpose. And then funky frames, funky
Yes.
sunglasses. These are so
So much fun to go
fashionable.
out of the box now. Real wood on the frame. So this is one of our Prada.
People like Beyonce, Rihanna have been seen wearing this particular Prada. That's usually like a limited edition piece that we can get we get in see on patients, or sorry, celebrities as well.
So I don't know if you, in recent times, Jared Leto was in town filming
Yeah.
the Suicide Squad
Yeah,
downtown Toronto.
nice.
So he actually was wearing this particular Tom Ford frame. He was seen downtown. So everyone's going bigger, bolder statement pieces. They like to see the celebrities wearing them. So
And
get
so
out
you
of that
can
comfort
talk-
zone.
Talk to you about the different the covers and the lenses that you're going to put on top of the frame. All the advice you can give when people are going to get
coatings.
set
For
up.
sure. So if someone's coming in for non-prescription sunglasses, it pretty much it is what it is. Nice anti-reflective coating. A lot of them come in polarized. If you need a prescription put in there, but you really love a frame, it's easily customized. So we take out the lenses that are there. We use a lab to apply the same type coatings. And even with the coatings, it's 100% customizable.
Okay.
So are you outside a lot, inside? So
Perfect.
limitless options.
Thank you so much, Dr. Anderson, Dr. Khan. It's
Thank
been a
you.
wonderful
Thank you.
episode. For more information, you can go to the shops at Angus Glen Optometry for more information. Thanks to everyone for watching. We'll see you here next time on In the Know.
Thanks.